Today we're going to talk about how to break in your new orthotics. Now, the first thing to discuss is what kind of orthotic do you have? There's several different types of orthotics that we make here at Third Coast Foot and Ankle. This is our most common one. It is made by Go4D, which essentially means we're using a 3D printer and using very exact measurements to build that orthotic. We also do make more traditional orthotics that involve casting. They tend to be a little bit bulkier. And then we also make more what we call accommodative orthotics, and these are really for our diabetic patients or some patients with really severe arthritis, which are needing a little bit different type of orthotic. Once again, these are also quite thicker. Sometimes we will actually make dress orthotics too, so we can make the orthotics quite petite and thin. Typically, once again, I'm using that 3D technology to really get this laser precision. Now, when you get your new orthotic, it's really important to pair it with a good shoe. Typically, the orthotics are going to work best in an athletic type shoe, though we can move them around from different shoes, and they do work quite effectively in a lot of different kind of shoes. But when we're breaking them in, let's go ahead and break them in a good quality athletic shoe. Any shoe that has a removable insole is what you're looking for. So there are a lot of athletic shoes out there that have these insoles glued down, or they don't really have much of an insole. You want one that's going to have one that you can go ahead and take out. These are just pieces of foam. They're not actually providing you any structural support, so it's okay to take them out and toss them to the side. Then you would simply replace that with your new orthotic, okay? Most of the time, we don't need to go up a shoe size when we get an orthotic, though sometimes we do. You can see this one is probably just as thin as that insole you removed out of the shoe. But if you look at some of these other orthotics that tend to be a little bit thicker, you might need a bigger shoe in order for this to fit. Once again, these are a little less common of a shoe insert that we make here at Third Coast. Now, oftentimes, traditionally, you sometimes need to trim the orthotic to go inside. This is very, very rare with our Go4D orthotics because they are precisely fitted to your foot size when we take those images. Whereas these, it's not uncommon. Usually the lab makes them a little bit longer so you can have that trimmed off. We will typically do this for you right in the office, but if you are having difficulty with that, you can always trim little pieces of the tip off of here. I don't recommend just cutting it off. Some people want it to be only 3/4 length or half of an orthotic. There tends to be a little step off, which can be uncomfortable. If you want an orthotic like that, we can build them like that. My preference though is to always start you with something that's going to give you the most stability, which is this longer orthotic. So once we have them in the shoe, I do not want you wearing them all day, every day. We're going to break them in slowly. Think about the first time you go to the gym. If you go all in right away, your muscles ache afterwards. The same thing is going to happen if you break in your orthotics too quickly. We are putting your foot in a more neutral position, a corrected position, which means we're going to be targeting or using muscles we have not used in a while. So rule of thumb is first day, wear them for 2 hours. Even if you feel fantastic after those 2 hours, I want you to take them out of your shoe. The following day, you can go up to 4 hours, but then once you hit that 4 hour, go ahead and take it out of your shoe. You can add hours in about 2 hour increments every single day. You might notice that once you get to maybe the 6 or the 8 hour, you're starting to have that pain. Go ahead and stay there for several days before you increase your time to the 10-hour mark or the 12-hour mark. And maybe you're not on your feet for 12 hours a day, and that could be a mere point. It should take, and it's not unusual for it to take, up to a month before you're used to your orthotic. So being used to your orthotic doesn't mean you're getting over pain. If an orthotic is painful, something's not right, and you should call the office and we'll talk you through it. If it's uncomfortable, if you're getting aches and pains, if it feels weird inside your shoe, those are all very normal feelings. Now, The next step of this is to introduce them to your workout activity. So I don't recommend using your orthotics right off the bat for running or exercises. I want you to get used to daily activity in them and then move on to using them in higher impact activity. So typically we're looking at that 1 month mark. And this is why I really suggest you follow up 1 month after getting your orthotic so we can make sure you've met those parameters, you're feeling comfortable, and then we can give you guidance on how to move them to different shoes, when to move them to different shoes, and what activities you should be using them, and maybe there are some activities that maybe we want to avoid using them in. Everybody is different, and we prescribe orthotics for a lot of different reasons, so there isn't necessarily always a gold standard on how you're going to use them. So make sure you ask your podiatrist or your doctor when you're going through that break-in period, if you have specific questions about activities, to review those. All right, so if you have your new orthotic, go ahead and put them in your shoe. Remember to go ahead and remove this insole. Just put it off to the side. You don't need it anymore. Obviously save it just in case you need to slip it back in for another reason, or when you are in that break-in period, you'll still want this in there when the orthotic is not in there. If you have questions, of course, always call your doctor. These are not easy things to break in. It's not an overnight process, but once you get used to them, you're not going to know how to live without them. So if you are interested in getting orthotics and you've never used them before, I'd be happy to go through the necessity of them or maybe the non-necessity of them for you, depending on how you're feeling. Call our office at Third Coast Foot and Ankle, and we'd be happy to fit you for your new orthotics.